Hello, Dr. Ramanathan sir. Can we start the session?
Okay, start.
Yes. Yeah. Thank you very much, sir. First of all, very good afternoon. Namaste, one and all. Myself, Dr. Poonam Vajpayee, on behalf of whole RAV team, I would like to welcome our respected dignitaries, respected governing body members, our respected Gurujans, today's respected guest speaker, Dr. D. Ramanathan sir, learned students and all the social media live viewers. I welcome you all in this today's 86th webinar in weekly webinar series Gyan-A Knowledge Voyage. We shall commence the today's session with sincere gratitude and pranam to our mentors. Respected Padma Bhushan Vaideshri Devinder Trigunaji, President of Governing Body RAV. Respected Vaideshri Manoj Nestriji, Advisor Ayurveda Ministry of Ayush. Respected Vaideshri Anupam Srivastava Sir, Director of RAV, for their constant direction, motivation and encouragement for sustenance of this webinar series. In today's session, we have with us as a guest speaker, respected Dr. D. Ramanathan sir. Sir is Managing Director and Chief Physician at Sitaram Ayurveda Private Limited, which is one of the oldest and leading manufacturers of Kerala Ayurveda medicines. Today, sir is going to share great insights on a topic traditionally enrooted Ayurveda from kitchen to industry, followed by a question and answer session where a participant can ask the question. Now, with a brief introduction of our today's respected guest speaker, we will start the session. Dr. D. Ramanathan sir is Managing Director of Sitaram Ayurveda Private Limited, Thrissur, Kerala, which is oldest Ayurveda group of Kerala, and it started journey of healing and nurturing people through Ayurveda and providing quality medicines and healthcare services as well, with blessings granted by Kochi Maharaja. Now, through legacy of 100 years, Sitaram Limited has established himself as leading manufacturer of Kerala Ayurveda medicine and renowned provider of Ayurveda services, both in curative and wellness sector. Under guidance of Dr. Ramanathan sir, a renowned physician and leader in Kerala Ayurveda, who has been conferred with Government Award from the Government of Kerala. He had been recognized as Guru of RAV and also got Fellowship of RAV. Sir is founder member and current General Secretary of Ayurveda Medicine Manufacturing Organization of India and Chief Editor of Aushadam magazine in Kerala. Sir is also member of Forum of Indian Traditional Medicine by Ministry of Ayush, Government of India. Sitaram Ayurveda is a well-equipped and ergonomically set manufacturing plant with modern machineries, a Government of India DSIR approved R&D lab. It is also first joint stock company in Ayurveda in South India. It is first 9001-2008 certified and GMP certified in Ayurveda. First company to conduct clinical trials in partnering with Government of Kerala and Drugs Department. And this group is also offering olive leaf CGHS approved Sitaram Ayurveda Hospital in Thrissur, Kerala. Now, without wasting much time, I would like to request Dr. D. Ramanathan sir to please conclude the session. Welcome, sir. Over to you, sir.
Welcome, Dr. Poonam. Thanks for your nice presentation. And so, madam, are you audible and see my?
Yes. Yes, sir. Yes, sir. Visible.
So, good afternoon. I am really thanks for the Rashtriya Ayurveda Vidyapeeth. Give me a chance for this presentation, this webinar. I think my subject is a totally different subject. That is a traditionally enrolled Ayurveda from kitchen to industry. The subject is totally not in a disease wise, but it is a totally different subject, kitchen to industry. So all the webinar or seminar, we have started with a prayer. So I have also started with a prayer, especially in Kerala. Most we are following the Ashtanga Kriya. The Ashtanga Kriya, the first sloga is Ganga-A Sadadanu Shaktan Asheshagaya Prastana Sheshan Autsikya Moha Ravi Jagana Yuva Purva Vidyaya Namostu Tasmai. So, What is the difference of this sloga? Who is Apurva Vaidya? You see that the sloga is started not Rogadi Raga, it started from the Ragadi Rogan. So Ragadi means what is the Raga? Aulsikya Moha Arabi. Yes, more than per day, more than 40 or 45,000 of the thoughts daily influence in our body and mind. So this thought may be good, sometimes it's positive, sometimes it's negative. That is Aulsikya Moha Arade. Who will compromise? That is a Jagan, that is an Apurva Vaidya. So why taking this sloga? This is a 12,000 years back. You see the human being, and you see any difference of the present situation of our brain? In my experience, today morning's experience, there is no difference at all. So, what is 12,000 years back? Our humans are living in the forest area. So, what is the main job? Forest area, all the time they are seeing animals, and there is some fear, they want to save their life, and they also want the food. Sometimes they are getting some food, sometimes due to the heavy rain and all the reason they are not getting proper food. All the time that is Aulsikya Moha is there. Today itself morning, Brahma Muhurta. I want to see this today morning we are using all the time. This is without our WhatsApp anything. It is not possible to nowadays live. So today morning 2:45, I got a sound, ship sound. Then immediately at Brahma Muhurta, I opened my WhatsApp. I saw a beautiful message. That is our Ramakrishna Rashtriya Ayurveda Vidyapith official manager. He sent the webinar notice to all the Shishyas and Gurus at 2:45. So what is the comparison is here? Olden days at 12,000 years back, that is all the time they want to save the life or enjoy the life. So that is still is going on to continue. That is why I am repeating here. So before start my webinar, I request all my participants, because this subject is totally different. But you have experience, I want to share my experience also. All the needs of the prayer, what happened now, all our eyes, ears, nose, everything for the open to the nature. But unfortunately, we not spend any 1 minute or 30-second time, not you look your own body. That is a problem, or main problem in the Ragadi. That is Aulsikya Moha. So before starting my webinar, I request all my participants, maybe my Gurujis are here, I request shut your eyes and close your eyes and concentrate all your indriyas into your own mind at least 30 seconds. Inhale and exhale. Please concentrate your mind. Cool down without any type of the thoughts. At least 30 seconds. I request one more. Shut your eyes. All your indriyas. I think Poonam is also doing this experience. Close your eyes. Concentrate all your parts, Panchendriyas, into the mind. Ganga-A Sadhana Asheshakarya Prasana Shesha Aulsikya Moha Ravidagana to Apurva Vaidya Namo. Yes, that is the first part of the Vaidya's job. Then we go to the Rogadi. Then you see what is the purpose of the yoga, that is our Sidosha Siddhanta and our seven Dadus and Mala Mutra. This is we need is a Vayu Pitta Kapha, that is Sidosha is balanced. All the doshas, these doshas, definitely is influence due to the ahara, due to the manovikara, due to the food, that is influence and imbalance of the Vata and Pitta and Kapha. This Vata and Pitta and Kapha, definitely our seven Dadus and Mala, Dusha is happened. This is the concept. So that area, already we have started Manasa, we are cleared by the mental control by the yoga or that type of the meditation we can manage. But we can, how to are controlling the dosha and the Rattadadu only by the Aukshada. What is the quality of the Aukshada? Prahugalpa, Prahuguna, Sambannam, Yogyam. Prahugalpa, how many formulations are available in the market? That all the formulations, single herbs, or 48, 80 drugs of the formulation, for your Savana price is a 48 drugs, and at the same time that is a Guluji, this is a Tinosphoria, Cordyphoria, also you are getting the single herbs. Everything is a Bahugalpam, but we say all the Bahugunam. All the drugs, that is a Bahugunam. There is a Virya Guna Vivaga Prabhava, good number of the Bahugunam, and also need of the Sambandham and Yogyam for the Aushadam for the treatment. This is the principle of the medicine. So, I come to the picture, kitchen to industry. You see the picture. Olden days, we are manufacturing all type of the, without any regulations required. You see the difference of the old one and new one. The kitchen is unorganized, but industry all the times a need of the organized setup. What is the kitchen? Yes, olden days, 12,000 years back, up to before 1974, there is the industries are there, but that is not, that like the regulation is not required. So the difference of the kitchen is there, one Vaidya or his family and his Shishyas and their Panjaragas and your workers all joined together and committed their mind, full-time mind for this manufacturing, this process, not the manufacturing process, the preparation for the processing of the medicine. Is it possible nowadays? No, it is not possible. Everybody's rules and regulation is there, and families also, one family, maximum 1 or 2, 3 members are there. Not large scale of experience, grandfather or grandmothers are not available in the field of the family. So what happens? It is a need for the prepared medicine is required. So that prepared medicine, up to 1974, there is no rule at all. Anybody can manufacture Ayurvedic medicine anywhere. That is a cancer. So what happened? Number of the tradition, the kitchen material, they are misusing for the manufacturing, and this type of the medicine they are preparing and hand over to the people. Definitely there is a question, it is a safe or not. That is why the government of India introduced the Drugs and Cosmetics Act. So up to 125 years, almost all the factories of the kitchen area. Now slowly started North India, that is Tabu, Kaviraj, Dudhpa Vesha, I don't know, more than 100 years of number of the factories. Kerala, Kottakala, Arisala, my factory is Siddhara Ayurveda. Number of the 100 years back of experience, slowly, Vaidya preparation they have started. For the bottle, whatever they want to for Vaidya, they are preparing. That is giving to the preparation aswas and arisha and quality control kashaya, ghee, oil, and also guligas, basmat and churnas. This type of the slowly they have started. Their own experience product also their Vaidya's experience for product also started. For your experience, nearly now 4 lakh Ayurveda registered medical practitioners, nearly 280 or Ayurveda medical colleges, and 9,800 micro, small and medium enterprise production in the factory now in the Ayush department. This is a license now. 9,000 MSME scheme. What is the introduction? Ayurveda pharmacy, emerging and independent science, global acceptance of Ayurveda. The science we need, the government of India want to, it is just like a Chinese medicine. We want to need global acceptance of Ayurveda. So that is a Drugs and Cosmetics Act 1940. This is introduced, I already mentioned that is 1974. But still, there is an exemption. The Vaidyas Hakims exempted this rule. Suppose any Vaidya, any Hakims, suppose they want to their preparation, medicine preparation only for the patient, there is no need for any rules. It's all still they are manufacturing at the kitchen level. That level of the practicing is still is going on in India. That's not at all a problem. But the large scale, for the purpose, there is a regulation is required. That is the regulation we have started. Ayurvedic for emerging independent science and global aspect and good manufacturing practice, good agriculture collection practice, good laboratory practice to ensure that is the primary and cosmetic sold in India are safe and effective. Product conform to state quality standard. Each product is the need for the state quality. Suppose you are going to the kitchen area. Sometimes, suppose the kitchen area, suppose your family, their preparation, one food, maybe today food, that is totally different is next day. But that is not allowable in the industry level. That is the difference of the kitchen and in industry. Olden days, the kitchen, suppose we are manufacturing our own food, including our food. Today is good food, sometimes next day there is a difference. Salt is more, sugar is less, or sometimes sugar and that is the combination is different. But industry, that is not allowable. That is the difference of the kitchen of the industry. So, this is a GMP area. The consistency produce high quality medicine that meet the international standard requires the responsibility managed healthcare. I repeat here, what is the consistently produce high, that there is no possible to batch variation. Yes, sometimes is the herbal collection, all other chances are there, but it is the duty to consistently produce high quality medicine that meets the international standard required for responsibility managed healthcare. And also need now the collection on the area. I already mentioned that olden days we are getting the product from Vaidya. Vaidya knows that each product where is available. The Charaga, what is the principle, go to the Charaga Samhita. What is available, what type of the raw drugs is available in his area. That's collected, plug it and prepare it and hand over to the physician, yogis, patients. But now it is the availability of the raw drugs in nearby our area is less due to the deforestation. Olden days we are getting plenty of the Ayurveda drugs in forest. Due to the deforestation, the government is restricted to the collect of the Ayurvedic drugs, especially the bark and all things. Now we want to create a big problem, that is the collection of the raw drugs and from the forest. And we need for the collection only from the agriculture side, not mentioned in the forest area. So that area we need a good agriculture and collection practice is required, that is the EAPP. And also we ensure the quality and integrity of the sales test data, that is the GLP. And how many, this is the raw material, herbal origin. Dr. Poonam, are you hearing properly everything? Doctor Poonam?
Yes sir.
Everything going on well?
Yes, everything's well, sir. Please
Comfortable?
Yeah.
Okay. Okay. This is the raw material. That is how many type of the kingdom is there? Herbal kingdom, animal origin, and metals and minerals. This is a kingdom available. Whatever mentioned, Jagateva announced to them. Everything comes with these three areas. One is herbal origin, another is animal origin, and third one is metal and minerals origin. This is very interesting. You see that more than 7,500 species are available in the India now, but we are using less than 400. That is enough. Suppose 347 herbs, quality herbs, and 65 minerals and plasma, and fresh herbs, 61 herbs is there, extract, and 21 extract, and animal parts. That is enough for the manufacturing for the purpose of the okay, extract 29 and animal parts. So how many drugs you are required have only 347. You see the difference of the herbal, difference of the raw materials parts. Why? Old plant, desktop only 44, resin 13, hardwood 9, stem 8, rhizome 24, root more we are using the roots 51, flower 10, and leaf 5, and bark 34, and fruit and seed 75. So all the for the generic product, this is the enough for total less than 450. Maybe some difference in the state-wise the difference are there, but maximum you want only 400, 450 drugs, including the minerals you require. You can manufacture your product what you want exactly. Then, how do you RM quality assurance now? The quality assurance as per the API, one is a macroscopic. That is olden days, all one Vaidya is required. He knows the manage on the understanding this product, what is the name of the product, and what is the taste, and what is the quality, everything he is understand all by the microscope. But now it is not possible. Now olden days we are getting everything by the forest, or we are collecting the genuine, non-profitable mind setup of the Adivasis. Now the mind setup is changed, so everybody is in need of the profit, and they have had adulteration. The most of the 20 or 80 products, 480 products on the eyesight, you cannot identify this is a genuine, which is a genuine, which is an adulterated. That is, we are facing the now as a problem now. So that area we need a analysis method of microscope. That is need for the botanist, very experienced botanist you are required. Then only you understand this drug is original or not is adulterated. And I also see the phytochemical analysis to total ash, acid, insoluble ash, moisture content, oleated oil also, etc. is required. That area you need a beautiful chemist also. And sometimes that is microbial conditions are there, pesticides are there, so that how to your product is any bad influence of the microbial condition, that before that entering to your factory, you can check it and correct it and ensure that the microbial conditions are required. So one product, macroscopic, one Vaidya is required, one botanist and microscopic botanist is required, one chemistry part is also needs some particular product, and also that is the microbial condition, that is the scientist also required. So each factory now, one Vaidya, only this is a QC area, one qualified Vaidya, BAMS or institutional, especially for the post-graduation Guna, and also MSc microscopic and experienced herbal area and the chemistry part and also microbial conditions you can analyze. This is the method how to microscope, TLC, HPTLC and UV spectrometer is installed. So you see that this is the ramacham. This is the ramacham. You see you see the difference of the original way. On the section we collected, and you see the microscope, you see the difference of all the area. First we said ramacham. This ramacham you take the section, you go to the microscope, you see the section wise areas is there. Then you understand, yes, this is the original Vishira. Vetimeter. This is the number of the same type of the vetimeter. They are added. Suppose you are purchasing a 50 kilo, 100 kilo. So you don't understand. So each area you can identify. Your chemist or botanist went together and take the section and go to the microscope. Then go to the idea. This is the good one or not one. This is a microscopic analysis. You see that this is a formula for mainly using the Manasimisan tablet. You see that the difference of the Saraswati executive formula, that is a new one. But market, you are adapted what we are eating, Epidera, Girandia, we are available in the market. But on the fine morning and macroscopic level, you don't identify. This is our problem. The Somalada is one of the main ingredients of the Manasimisan. The juice is one of the best one for our anxiety purpose, and all type of the Mansi Vigara is the best one. Formula is the Sarvastima serum. But this is a rupees of 340 rupees per kilo now. But at the same time, the epiderma, when the adaptation formula is available is 30 rupees. What is the difference of the rupees? 30 rupees and 340. But on the macroscopic level, is everything the same. So we want to just take the section, and botanists, they want to see what is the difference at all. If you want to see this type of any conditions are there, so definitely you don't to remove it and ask it to give the original one. That is a duty now all the area. So this is a Kadaka, that is Haridagi. Adaptation and quality assurance of the chemical constance is required. You see the TLC, you suppose you are taking the thin from a chromatography, you see the difference. What is the difference of the Haridagi? Sometimes the same type of the Haridagi feeds are available. So you can, your own house, you can develop that is CLC protocol, you check it, and your botanist will correct the issue. This product is the original or understated. Otherwise, what happens? It is affected your product. Who will suffer? Ayurveda practitioners. Why? Because I am a physician. I know the subject very well. I know the Tridosha Siddharthas. I prescribe what they are mentioning the Shastra. This medicine is very effective in Kapha Vigara. This medicine is very effective in Pitta Vigara. Why? This formulation is mentioned as per the norms of their without the good with the good product. But is the adaptation is effective? No, that is very badly affected. What is one of the main reasons for the Ayurveda we are facing the issue? So you need the TLC powder, microscope, ABCD. This is the effective of the Nalpamara. That Nalpamara is very effective for the skin diseases. So now is the plenty available in the Nalpamara. Maybe 20% or 30% is not an original one. Because all of the number of the bars, they are mixed the bar. So what you want, you can powder. Only section on the macroscopic level, you don't understand anything. So you want to go to the experienced botanist, he sees the microbiology, microscope analysis. So they get each product. You see the difference of each product. All the difference are there. So what the cells are there, everything you can understand, properly understand, then only you take the good quality or not. This is a kurkuma longa. Nowadays, the kurkuma longa, everybody is taking the curcumin contents from the source, from the extract, then only to the sell to the market. What is the benefit of the product? So this also you need how much volatile oils required. For example, you see this is a jeera. So jeera is needed 3.99 curcumin synomium volatile oils required. So you don't know on the sometime there is your purchase a 10 kg or 20 kg of jeera from the market. What happened nowadays, suppose I am the factory, I am running a factory. Daily, per month, I need nearly 500 kilo of the jeera. You know what happened now? After the extraction, number of the raw material sellers want to request me, please give that extracted. After the drying, you give, they say, we are ready to give 50 rupees per kilo. Then I have to, but I am not giving anything because suppose I got a 50 rupees, what happened? The same product comes to my factory also. So I don't entertain because I got a 50 rupees per kilo. But this is happening, what happened? Nowadays the jeera extraction, they are taking the jeera. You see that you see here, this is that area is a volatile content. That is some special apparatus are there. One chemist job that visits here jeera and volatile oils, that is some preparation methods for the understanding of the volatile oil. That is every jeera, that is 3.99% of the jeera oils required. You know what is the present rate of the 1 kilo of the jeera oil is more than 3,000 rupees. So what is the present situation to do? So we need nearly a chemist is required to understand this jeera and volatile oil is there. Then only you can recommend it for the medicine. This is also for Devadara. This is also for the Pipali. Number of the products, that volatile oils, I already mentioned that here, that is a kurkuma longa. Also nowadays available in the market. Otherwise, you can prepare proper understanding of the purchase system. You have the trouble that your product will keep creating the problem. So I request, is it possible everything in the kitchen area? No, it is possible. Is the kitchen area, it is possible now. So that is the need of the regulation is required. The government is understanding, you understand how to, you conduct adulteration, which is a good product. That is, we have started the methods of the kitchen to the industry. So industry, that is a need. Now I have come to the activities of GMP certificate, the size reduction, evaporation, separation, aging, inclination, blending, and washing and cleaning, filling, packing, storing, transport, etc. And quality assurance and quality control at every stage of the production. Quality QA and QC at every stage of the production. First we want to the traditional cleaning. Okay, the large scale it is possible. Now we have developed the washing and cleaning methods of the machine. Is the dust and that vermin, foreign matter, microbial growth, heavy metal contamination, everything by washing, by automatically machinery will wash it proper. You see the difference of the cleaning of the material after the washing of the machinery. Maybe human being also possible. How many kilos is possible? Maximum 10 kilo, 20 kilo. And sometimes somewhere it is not possible to properly wash it. The machinery can do it everything with properly. That is also need an understanding for standard operating procedure. Suppose you wash it, how much time you require, how many rotation you are required. That is need a SOP. Otherwise, this is a water extraction, that is the chances for the alkaloids, our own product wastage also is there. So each 340 drugs, the cleaning also you can develop standard operative procedure in training also is required. That is also is required. For a very interesting thing now. Nowadays you have heard that our Guruji, that is the Guruji, Tinosphoria cordifolia, that is lead content is more. One doctor is sent the letter to the prime minister also now. That is we are facing a problem in the that is this lead is very badly affected in the liver and all the things. So this Tinosphoria cordifolia, that is Amal Pitamara, Guruji, one plant in my hospital in nearby the town. I planted that Guruji planted one plant. Then after that one plant, 6 months, I got 15 kilos of the Guruji. Then my Dr. Harida, quality control, our department, she collected this Harida, that is a Guruji, from that area and properly dried, and before cleaning, she sent for analyzation cadmium, lead and mercury and arsenic. You see that the 2.051, but less than limit, but you see that lead is there. You see the lead, other is everything free, cadmium, lead and mercury, arsenic free. But this area, only why? Because my factory, my hospital is situated in the nearby the road. So there is a chance of the lead petrol and contaminations are there. That is also affected that product. That you see the 2.01. And you see after the wash, then we can properly wash it. And both areas we are tested. That is only reduced at 181. But it is a allowable area, but there is a chances are lead is there. So suppose you are before entering to the manufacturing, it is a duty to understand each product is free from the heavy metal, the cadmium, lead and mercury acid. The maximum we are facing the problem here is the lead. But this lead definitely we can able to reduce. And also in the another part, I already mentioned good agriculture correct practice. Now it is our job, our Vaidya's and our industry's job, how we can free from the lead material of the Tinosphoria cordifolia. Where is available, which is a suitable place for the cultivation. And where is the free from the soil also, any chances for the lead material. Some area is the cadmium, some is the mercury. Nowadays, due to the bad tube light and everything, they are thrown away to the our agricultural land. That mercury also, there are chances for our own medicines under there. So, every area we need a understanding and free from the heavy metal. This is the main facing of the Ayurveda, not the kitchen area, including industry area. Future, we want 100% sure that is as per the norm. Otherwise, our product is substandard. The kitchen area practice or factory area, that is also affected, the patient is affected. So this is the washing purpose. Before the washing and after the washing, we can properly analyze, then you understand the whole area. Olden days we are putting everything in the sunlight drying, and still we are also the sunlight drying. But there is a chances for the rat and other things are, how many controls are there. So we need a greenhouse drying is required. So the greenhouse drying that we are free from the other pesticides. Here we don't, there is no restriction to the flies or any type of the animal, rat, that is ants, that is also very badly affected. This also affected our own pesticide or animal contamination is also affected in the body. So wash is also clearing, but the drying, sunlight drying is also required, and nowadays the steam dryer is available. You can control the proper steam there and how much suitable temperature from the greenhouse or sunlight you can manage here, and steam is 30 degrees, 60 degrees, 70 degrees, and we can manage the steam dryer also for the drying purpose nowadays. So first you want to analyze, next is properly washing and steam dryer. And after that, you can properly store it raw material. You see that is a gunny bag. Yes, some area is gunny bag is suitable. Some area not suitable for the gunny bag. Why the gunny bag is sometimes suitable? Suppose you are people. You are not keeping this a people. What happened to the any type of the plastic material? That is inside the temperature is more. That is that product is affected the fungus. But the gunny bag, wood gunny bag, that is you are keeping properly the gunny bag and your temperature, you properly arrange your the moisture percentage and manage your temperature properly, your storage. We can save the raw material, fungus and bacteria. And cleaning purpose, you see all the area when we are collected, when it's purchased, and what is the E size and bad size, we are everything mentioned that is clearly mentioned in the our area. We are marked all the gunny bags. The next one we are keeping the raw material storage, proper area understanding how much raw material cleaning and after washing. We are keeping the barrel type of the available, the good barrel, good quality barrels are available. We are keeping that area level. Next one is very interesting, the batch manufacturing concept. That is when you start a product, suppose your market or you physician, you want 100 Deshmula or 2000 batch of the Deshmula or you need 1 lakh or 20,000 of the one Ganga-A Liquada or any type of the Mahadik ghee, Dhananjan Phylum. So first you understand what is the batch size, how much product you want. Then you see that each area you can clearly record it. How many drugs you recorded, all the drugs your quality, name and how much quantity is required and all the area you can properly record it. And what is the process also you can properly record. Maybe you are not visible, these all are my Malayalam in Kerala, but each area we can specifically instruct it to the all the area, how much raw material is required. The same manufacturing record, the document process, raw material packing, and record each step. Then after that, it is went to the pre-process area. The pre-process area, that is you are using the pulverizer. That pulverizer, definitely what type of the mesh is required, how much, what type of the method, churnas or what type of the material you require, everything you are mentioned properly. Then you give me a proper training, standard operating procedure is required. You see that everything, your paper, one paper. Whatever this machine, how can you use it, how to clean it, everything you are patient properly, standard operating procedure. This is also all the area you need a standard operating procedure. Then you give a proper training for your own staff, workers and supervisors. Then only you are getting the proper, after the machinery, you are getting the proper products available in the area also. You see the machine, that is SOP display dryer. You see the SOP, this is the rules and regulations. In my company, more than 352 type of the standard operative procedure is there. What is the purpose of the standard operative procedure? This is not a job. This is a standard required. You want any quality medicine is required, how to this hydraulic press you can use it. What is the pressure you are giving? And you give the proper training. What is the maintenance is required? This is a system of the dryer. You see this dryer, how much temperature you must give it. Suppose any temperature, that is automatically another will come. So everything is properly controlled. So your product, your own under control. Otherwise, it's a standard operating procedure. Is manufacturing record properly. Everything you are mentioned A to Z, from starting to packing area, everything mentioned from the how much quantity is required, how much water is required, reduction you added, that is everything properly, and each Vaidyas and giving the signature here, proper signature, then only finalize with the quality assurance area, we keep it, and also label any drug controller, any department authority inspected the entrance to the factory. This is in a black and white nowadays. So, it is without it is BMR, it is not possible that suppose the drug control department give the notice and withdraw the license. That is the first step of the quality assurance of the process. And this is a disintegration and crushing, grinding, juice extraction powder method. This is the difference. You see the chop is old traditional method. Now you are getting the chopper, the new machinery is available. The traditional new machine is available. When you use the traditional method, the size of the reduction, now is at the disintegration. Number of the RPM, more than 6,000, 8,000 RPM speed, you will get the proper disintegration materials are available. 1,000 kilos, 2,000 kilos, and worker is giving a proper understanding. That is, some sleeves are using, and they are collected here. If the sleeves are the disintegration. Without, that is you see here, everything that is the temperature controlled. Why is temperature controlled? That is, this area, the rotation. This medicine is part, that is the chances for the energy. That is, some kind of heat is there. So that is need a cooler area also. That cooler is continuously cooling the cold water. So what is the benefit at all? The heat is not there. So automatically, there are any chances for any volatile oils in the part, that is also same. That is in the mission of the disintegrated area. Next one is the pulverizer. Suppose olden days you see that one or two ladies, they are keeping the lifetime, they are giving to the pulverizer. Now it is in a cyclonic type of the, where the pulverizer system is there. You will get it to 40 to 100 mesh of the powder from the pulverizer system. You see the disintegration form and the pulverizer form. Each product, I request inform you that each product, this type of the disintegration method is required. Suppose this is disintegration form, this type of the form, you don't get the proper extract. So, you give the proper understanding of the mesh. Each mesh is required. That is your understanding, your SOP. You have mentioned everything in the SOP. Which screen if you want to use it here. Everything they mentioned the SOP. And you're giving the instruction of the standard operating procedure. You see the disintegration. Almost, I am not 100% sure, almost it is electric. But at the same time, before the disintegration, your QC level, understand what is the moisture of that product. Suppose the moisture is more, that is very badly affected. So each product, that is Ayurvedic form of API, they have mentioned all the products, what is the moisture percentage is possible. Then only you are giving to the disintegration and you see the pulverizer form. In the whole time the shifting we are only, we are giving the method of the traditional method. Now with the vibration shifter is available, you will get it 100 mesh or 80 mesh, very good powder and very easily solvable mesh is available. Some traditional method of the grinding also, olden days we are using the grinding. Now it is with the grinder, number of the varieties grinders are available, different types of the grinders are available in the market. So everybody, what they have mentioned in the effective method of the pressure, use and everything, we can manage here. How can manage? That is, you can, what you want, you trial first here. That trial you use it here. Then you can arrange in a standard operating procedure. This turna, this material, how much water is required, how much time is required, how can you give, how much pressure you will give it, how many products is maximum capacity of this instrument, the grinder. Everything mentioned, you apply it, what you want exactly here. That is it. Olden days, you are getting the hotel, the Italy, the favorite Italy, always they are getting from this instrument. Now, everything is getting from the grinder. Any difference of the Italy, old now, the new one? Any taste difference is old and new? No. Because why? The hotel man is keeping understanding the tradition made and how to the manage for the manufacturing for the mechanical way also. Traditional method of juice. All the days we are getting press it and push it the juice, leaves and everything, and push it and pressure we are giving the juice. Now plenty of the juice expeller, easy extraction juice from the fresh herbs is available. This is the rotation method. Each area you will get a proper understanding of the juice, and without 99% of juice extraction, we will get it as the juice expeller. But how much possible to how a human being, suppose some human is capable to pressure more giving, but here what suppose he has not any health problem, that is also affected our own juice. Here, that type of the note, we can test it, and after that how much juice is extracted that area, and also you can SOP procedure and quality control, that is your own method way, then you will correct the juice method also. Olden days it is the traditional method of the drug boiling. So the drug boiling means olden days it is the drug boiling. Is it possible nowadays? Is anybody is giving this type of the time is waiting for the fume and all the heat and all the area? Is available the what case they are suffering? No, it is not getting the chances are there. So that is why steel method, the drug boiling system is started. And this is the drug seal. You see the drug in and basket there. We are giving the steam, proper steam. Then you give the pressure gauge. Then what you want, Agni, whether that is a Krishna Agni or Manda Agni, what you want in all the days in the test. You can give the steam properly here. That also, that steam also you will get in the pressure gauge. You understand the safety value and contents are there, and it's boiling properly, and you get the full extraction. Wherever this method is very easy now into the direct boiling system. That's right. This is you will collect the try and dry under the bucket, and will collect the material. Next one, after the extraction, you want the oil preparation, ghee preparation, or cider preparation, or area preparation. After the extraction, you have come to the, here there is a pan, then you added the oil, jaggery, and all the things are added. And after the proper understanding, what is the beauty of this one? Gentlemen, what is the beauty of the Ayurveda, sir? Olden days, that is, you see the extraction of the raw material from water. Then you are added the oil or ghee or sugar. And what do you see the difference? Here is the water extraction here is the ghee to the oil extraction. Sometimes you want the fat extraction. Some Daila, you are giving 3/4, 1/6 times of the milk also added. What is the purpose of the milk? That is the fat extracts are required, water extract is required, and also as an extra alcohol extract and kashayam, water extract. This is everything can proper control by everything by the steam. You see that we can able to control by the steam. So each area we can manage the steam area properly, understand what type of the agni you require, what type of the steam is required, evaporation is required. Everything can monitor. That is the possible now at the industry level. This is a vacuum evaporator. Nowadays the vacuum means suppose less than 100 degrees required. This instrument is due to the vacuum area, only 30 degree area they started evaporated. That is the vacuum evaporator. So very easily, without the compromise of the any product, the product quality and quantity and assurance, we can use the vacuum evaporator. So the vacuum evaporator very easily evaporated and economically light, and also there is a less stand for the there is a very less stand for the contamination, not with sometimes too much of heat. There is a chances of the deterioration of that particular medicine. That is also we can say it is a vacuum evaporator. That is a less need. That is 30 degrees, then there is a chances for the evaporation. Then we have come to the finishing area, cleaning area. Then we need a protocol of the testing material. Each area, analytic specified single plant material and also in asphalt and extra. Then each area I already mentioned that is a product identification, macroscopic, microscopic powder characteristics, lots of drying, total ash, acid, TSC, HPTLC, I already mentioned all the areas, but that is not repeated here. And what is a water solid extract? An alcohol extract, SA, test for heavy toxic material is the mercury, lead, cadmium, already mentioned that is our glutamine, that enough for your body for you. And microbial condition is there. So automatically this microbial condition also, that is free from the microbial conditions also. And also the pesticides area, all the area is required. And here this is analytical specification, asphalt and extra fermented liquids also, the same also, that is test of heavy metal, microbial, test of specific gravity, and need of the reducing sugar and non-reducing sugar. Suppose you are purchasing the sugar now, now everybody knows that in the yellow color sugar is a good one, Jaggery is good one. So it is a totally chemically purified jaggery. That jaggery you are added here, that is you are reducing sugar, non-reducing sugar, not compromised. So what happens without proper sugar, that is that alcoholic fermentation is not happen. So you test the before that adding the sugar, what is the sugar presentation, what is the non-reducing presentation, that is also we need all the area. Then quality control of the, madam, are you clean everything? Poonam?
Yes, sir. Yes, sir.
Going on well? No problem, is there?
No, going well.
Okay. Then quality control, we need Kashayam organic analyze, TSS and specific gravity, pH and organ lipid. This is we are supposed in Kashayam, Padolamuladi Kashayam. Olden days, one Voyage taste it and color and smell it, then he is certified, it's okay. Now we can understand that how much the total salt is consistent extracted for through the equipment. And what is the specific gravity? What is the pH and 3 points? Is it acidic variant or alkaline media or neutral? For example, nowadays 68 type of the kashayas is available in the market. For example, Sahajradi kashaya. What is the pH now? Is nearly nearly by the neutral side, 5.7 or 5.8. The same the Muluchizi kashaya, that is the pH is come to the maximum is come to the 3.4 to 4.5. So what is the benefit of the pH below the 3.44? That is very less of the preservative is required. At the same time, the Sahajradi kashayam is nearby the alkaline, is nearby the stick, you need more preservative. There is a chance for the contamination, or you can develop that type of the micro condition, that is the fermentation, you can develop that type of the chemical or your natural chemical test is required for that. So every area this is helpful. So how much required quantity is required for the method you are required. You see this is a churna, the microscopic and microscopic loss in dry. First is YJ macroscopic, then is microscope, loss of dry and total ash, acid, water and alcohol solid, and particular what is the size of mesh, 100 mesh or 80 mesh or 60 mesh, any microbial contamination is there, test for the specific pathogen is there. Why? Suppose I request Poonam, you are not a physician. You are consumed anything this specific contains the pathogen and microbial condition, you consume your body. What happened? That you will think as a Vaidya, it is our job. It is free from the all the area, from the microbial contamination, particle stage. What the Acharya mentioned the test, that is that we can leave it to our patient. It is our bound of duty. That is we are doing here. That is the beauty of the industry level is going on to upgradation. Did you see the triple churna? That is moisture, and you see the quality control of Ganga, that is color, viscosity, iodine value, and acid value, peroxide value. Suppose this value is not correct, within a 3 months or 6 months, this Ganga and Sila, there is a chance of the deterioration. Might be different, and there is a chance for the more without preservation. No need at all. You can properly use this life to 2 to 3 years. And then quality control of the Dhanindra theorem, reflective, static gravity, acid value not more than 2. Suppose the acid value is more than 4, that is the chances for immediate deterioration. It is very iodine value is more. It is affected the skin also, and that also there is a need to understand quality control of each thyroid and tablet, color, odor, distribution time, hardness, loss of dry, and microbial content and pathogen, and moisture not more than 10%. One tablet is available in the market, weight maximum 1000 milligram 1 gram, and hardness is not less than 5. These all you can test it properly, this equipment. Then addition, that is method of preparation, QC approved kashaya mixed with jaggery. I already mentioned that is the difference of the jaggery, and also transferred to the fermentation tank and added the adhigi, and 5th day alcohol, pH, TDS, acidity checked properly, and after the QC approval, the fresh shape churna added. You see the difference here, how the Acharyas understand. The Deshmudadishta, they have added the same product of the Deshmudadishta at the time of the extraction. This says more than 10 to 12 particular sweetness, then powder, and after they have added the fermentation time. Why? That is the alcohol. The Acharya knows that we need alcohol water extraction and also the alcohol extraction. Both. This alcohol extraction is also the preserve. There is no need any preservative at all. So that is keep it 20 to 35 for settlement, the final QC analyzation. Then you see this is a Niragajista. You test it how much alcohol. Not more than 12% alcohol is permitted for the government of India. So maximum is 6 to 8 to 10. And you see the pH and TDS and acidity is 1. Not more than 1. Suppose any asphalt and discharge you are entered to the market before 1. That life of the asphalt and discharge now not more than 6 days, 6 months. What happened? This acidity, automatically the fermentation, the fermentation is automatically is the deterioration, the alcohol is converted. And that is a type of the bad taste, bad smell. It is very badly affected. So it is a duty to acidity, not more than limit. Each area, each batch, you can check it. Then only you can do market management. Olden days is the traditional aging, if it possible. Now we are aging, every aging aswad and ashta. There is a procedure and process are there. But in the aging, olden days we are getting this kind of the same method of the temperature control. We are outer. You see the continuous water circulation. This wood also is applicable. And the continuous water circulation. What you want exactly here, that you will get it now, that was an extra temperature. Below 25 to 28 degrees temperature. Then only possible to the fermentation. So you can control the air conditioned room or cooling apparatus is required and water circulation is required, just like the aging aqua and extra. Then you will get the good and we need to go to the system time I am due to the running the short of the time, I don't want to go to the more detail. This is a porting system, car sealing, and it's a retailing finishing also we are getting now. It's a pouch patching is available now, and the kashayam concentration now, that is form changes. So I taken to 5 minutes this area. Nowadays the market, the kashayam tablet, kashayam churnam, and concentrated kashayam is available. How you are prepared the kashayam? One palam means 12 currents. Then 12 currents means one current means that is the olden days we are getting one current is only. Whatever the seeds are available, that type of 12 currents, how much is there? That is they are taking, that is one palam. Now after that weighing machine, that is the one current is with 1/4 gram. One palam is a 12 palam. About 12 into 4, that is a 48 gram is a one palam. So in this one palam, you can add 16 type of the water, 16 times of water. That is mentioned in the water. So 48 into 16, how much? 768 ml. Then you can start the heat properly, giving the heat. Then 1/4, that is 1 nadi. 4 nadi, 1 prastha. This 1 prastha is ready to 768 ml into 192 ml. Yes, 192 ml. Yes, for 768 ml is 194 ml. So this one the 1/4. After the removing all the text, actually this 192 ml is required. One bala medicine is required. Morning 96 and evening is 96. But it is not possible. That is the Vaidya, our Acharyas request, reducing again 1/4. It comes to the 48 ml. This 48 ml is 24 ml is morning and 24 ml is the evening. That is the concentrated kashayas available in the market. So then I already mentioned that is already mentioned some the method of the pH, how much pH is the acidic value, then how much fermented that the preservative is required. So that is a calculation available in the market. WHO food preservatives are available. So it is about the Guluchari Kashayam, 20 ml. It is required at 0.5 ml. While very less required only preservatives required now. Then what happens? This is now this Kashayam is although now the industry developed this Kashayam tablet form. How is possible? This 40 ml moisture, I already mentioned that the forced evaporation circulated machine. We can apply the forced evaporation circulated machine and completely remove the water soluble extract, and you get the 6 gram is powder. This 6 gram powder you can do 1 gram tablet. So this 48 ml Kashayam olden days 24 ml or ml morning and 24 ml evening. Some companies that 48 ml is reducing to the 30 ml. Some companies are reducing the 40 ml. Actually, the 48 ml, 48 gram medicine, 48 ml. Now you are giving the 6 tablets. That is 3 tablets in morning, the 3 tablets evening. So how much consumption is giving? The 6 tablets you have added the 30 ml water or 48 ml water. What you want see what is the naturally you are extracted. The same. There is no difference. Color, taste, effectiveness. There is no difference at all. But still, this type of the area, unfortunately, most of the doctors doesn't know. That is one of the main reason of the growth of the Ayurveda. So you understand this method. Yes, it's crude one. 6 tablets is equal to the 48 gram. 6 tablets crude is for your morning and evening kashayas liquid. So this is a method now is available, that is why it takes too much time. This is a guliya, now is a tablet form. Older days everything is a guliya, that is a contamination chances, now it is available in the tablet form. And churna is available in the shaddan and everything is a capsule form with easily consumption is possible. And now it is the same way like that. Gelatin capsule, 101, Dhananjanam, Visvaga Sneha, everything you are available in the gelatin capsule, very easy. Suppose you want to olden days, the Shiravala 10 drops, that 10 drops is available in the one capsule, morning and evening. You suppose that Visvaga Sneha, it is not possible nowadays to take that smell and everything. You take one Visvaga Sneha capsule, you will get 4 to 5 through purgation also. That type of the form changes are available in the industry level. This is a double blender, conblender, and tablet compressing machinery is there, and this is for preparation of the basmas and kashayas and that, etc. And the inside factory raw material is processed, waste material, finished goods, other transportation, and process then the process flow like that. I give you 2-3 minutes, 4 minutes of what is going on the my manufacturing process video here. You see the video, then you see how much time you require for the beautiful one manufacturing section. So, it is a nutshell, changing trends in the manufacturing process about marketing, large-scale production, and economically and time-saving, more profit for new formulation, and quality standardization and improvement, and complaint, that is a rectification, any complaint from the market, that is also rectification. And the fundamental principle of Ayurvedic pharmacy, sustainable harvesting method and afforestation, minimum pollution of natural resources, ethical waste management, and prevention of the heavy metal contamination related to the Ayush standard. Thank you. This is my small presentation. I hope it is useful for the kitchen to the industry. Thank you, madam. Thank you.
Yes. Thank you very much, sir, for a very knowledgeable explanation of a topic and also updating our knowledge on various aspects which are involved in a quality assurance process on an industrial level to ensure the safer drugs as well. Thank you very much, sir, for sharing wonderful presentation with us. Now, we are open for question and answer session. If anybody is having any question in mind, any doubts or queries, they can ask. You can raise your hand as well. I will convey the question. Any questions from the viewers? Anybody would like to ask any question related to the topic? They can ask. Please unmute your mic and ask. Or you can write in chat box as well. Okay. I think there are no questions, sir. Thank you very much, sir, for a very knowledgeable session today with us. And to extend a formal vote of thanks, I would like to request Dr. Deepak Joseph. Over to you, Dr. Deepak.
Good evening, ma'am. It's an honor for me to propose a vote of thanks on this 86th webinar of Gyan-A, a knowledge of Voyage, a webinar series organized by Rashtriya Ayurveda Vidyapith. On behalf of the organizing committee, I would like to express my gratitude to Dr. Ramanathan. Sir, thank you for a beautiful session, and the way he has presented his topic shows the command and the expertise he has in this topic, starting from the basics of Ashtanga, going to the gunas of Aushadha, and the importance of explaining how the drug is collected, from where it is collected, stored, and processing. Thanks a lot, sir. I would like to thank wholeheartedly respected Padma Bhushan Vaidya Sri Devendra Gunaji, governing body RAB, for his blessings and continuous encouragement. I express my humble thanks to Vaidya Manoj Nesri sir, advisor, Ministry of Ayush, for providing his immense support and guidance. We are highly obliged to you, sir. I extend my gratitude to Dr. Anupam Srivastava, Director RAV, for his constant guidance and motivation. I thank him for his valuable contribution and encouragement in all our efforts. I must thank the organizing team of RAV and the volunteers who have worked behind the scenes for their tremendous effort to make this webinar a great success. I'm also thankful to all the gurus and participants who are connected with us through this online series. The topic for the next webinar will be shared with you very soon. Thank you. Have a great day.
Thank you, Deepak.
Thank you very much, sir.
Thank you, Manu. Thank you.
Pranam, sir.